okay?
I think, yeah, I'll be fine. I'm good.
Are you sure? Is this that asthma thing that the doctor was talking about?
Yeah.
All right, where's your inhaler?
Counter.
All right, I'm on it. You all right? You got it?
Yeah.
How's that? Doing good? Talk to me, babe. What's going on?
I can't breathe.
All right, phone. Hi, it's my wife. She's having trouble breathing. She says her chest hurts. It's 142 Sky Lake Rain. She is. Her breathing's really shallow, though. I think it's getting worse. Yes, 2 weeks ago, she had a lung infection. Last week, they said she had asthma. Okay, please hurry. Okay, babe, they're on their way. Right, here, hold on.
Hey, what's going on?
I'm having difficulty breathing.
How long has this been going on for?
I don't know. Maybe 10, 15 minutes.
Okay. What kind of medical history do you have?
I was just told I have adult onset asthma and a respiratory infection.
Okay.
Oh God. Oh,
Have you taken any medications for that today?
I just did my inhaler, but my head, I'm starting to feel dizzy. Oh God, I'm starting to feel dizzy.
It's okay. Just try and take some deep
Oh,
breaths
baby
in through
girl,
your
mommy's
nose,
gonna be okay.
out through your mouth. How long ago did you have your baby?
3 weeks ago.
Okay.
Oh
Just a couple of stickers, okay? All right. Let's see.
God, I'm dizzy.
Okay, yeah, I think you're probably. Let's go ahead and get her on the stretcher and keep going to the hospital. Okay, her O2 stats low. Let's go ahead and get her on some oxygen. I'm showing BFib on the monitor.
We got a pulse?
She doesn't have a pulse. We need to start CPR. I'm going to charge up to 200 and we're going to go ahead and defibrillate her.
Okay, clear.
Clear.
All right, 30 seconds, guys. Who's got report?
All right, what you got?
Okay, I've got a 28-year-old female. We were called out for respiratory distress, and she went into respiratory arrest on us. She went into VFib on the monitor, and we immediately started CPR.
Please.
Defibrillated her 2 times and given her a milk.
No,
All right, she's postpartum?
Yes.
Excellent. All right, can we get another...
I just want to go home.
work to get,
I just want to be with my family.
set for another dose of epinephrine.
I'm done being a mom. I just started being a mom.
All right, 18 left AC.
I just want to be with my daughter.
We're on the monitor.
I don't want to be with my husband.
All right, I'm ready.
I just want to be with my family.
One of Epi's in.
Please, no. I just want to be with my family.
50.
She needs me.
My husband and I are both educators, and we've been married a few years, and we decided, oh, we're going to try to have a baby. So we started trying, we got pregnant, we were so excited, and we went for our first ultrasound and we found out it was triplets. We got to Friday and they maxed me out on labetalol, they maxed me out on hydrazoline, they could not control my blood pressure, and I just knew it was go time. So we go in, they get the babies out, I start feeling like I'm gonna pass out. I didn't know it at the time, but I had had a severe hemorrhage. And luckily, before I had the boys, they had already done the screener on me, the cardiology screener. So they had done an EKG, they were scheduling an echo for me. Cardiology was already following me. I was in the hospital several days. My blood pressure continued to be really, really high. And so I went home on a maxed out dosage of labetalol. But then 2 days after coming home, I was back in the ER for a third admittance for high blood pressure, and cardiology was right there. They had already been tracking me. They knew who I was. They were ready, and they started making adjustments to that medicine. They got things adjusted, sent me back home with a follow-up scheduled for the very next week. So I came back in for that, and then it was amazing because I was on 3 different medicines at one time. But the maternal cardiac program, they were calling me every week to check in on my numbers, to adjust my medicine, to try to wean me off as they could on the blood pressure. And then when I had issues, I was able to call them. Even as far out as 6 months postpartum, I had an issue with a little palpitation. I was at work, I got dizzy, and I was able to call Savannah right then and there while I was at work, tell her my symptoms, make an appointment. I went in to see her immediately, got another EKG, ended up with a heart monitor, but I had that connection to that program, so I knew what to do when symptoms arose. I had somebody I could reach out to.
I wish I could say that my journey to get pregnant was something really exciting the entire time. I wish I had that story. That was gonna be Bob. So I ended up delivering at 26 in 5 days, but the first sign happened around 21 weeks or so. Up to that point, I had a great pregnancy. Maybe a little nausea, a lot of cravings, but great pregnancy. And one Sunday morning, I woke up, I had a headache. I wasn't feeling the greatest, but there was some other stuff going on, just normal life stressors, and I just kind of chalked it up to that. But it happened overnight, and it was very scary. I kind of, in my back of my mind, I kept telling myself, everything's fine, everything's fine. My background is emergency department. I've seen a lot of very sick people. So when I compare someone being sick, I compare it to the worst thing that I've ever seen. So I definitely was downplaying all of my symptoms. There was a reason for everything that I felt, for my headache, for my body feeling so tired, for my legs swelling, and I was pregnant. So on top of that, you have all of your normal symptoms of being pregnant, but then your life that just kind of causes you to also have these other symptoms. And so I just kind of downplayed everything. It definitely was that first admission when I was kind of laying on the bed, and all of a sudden I have the perinatologist walking in, I have the OBGYN walking in, and I have now the cardiologist with a PA and the pharmacist, this entourage of people just walking into this room for you because they think something's wrong with you. And definitely in that moment, I started to take things a little more serious, where I'm like, why are you here? And it's because they did the CBD risk assessment. Somebody saw something in me that I didn't see for myself. So somebody advocated for me when I didn't think I needed to advocate for myself.
Don't assume the symptoms are just normal. Even if it sounds like typical, the screener is so fast, it doesn't take much time. Screen them, see if there's any red flags flying up, because it could save somebody's life. Speak up if you feel like something's not right. Even if they're saying it's normal, this is what typically happens, you know your body, and you know if something's just not right, speak up, be an advocate, keep talking until somebody listens.
I hope that the CBD risk assessment is implemented to more than just the hospital where I was at. I hope it's taken and put into practice everywhere. And I hope that when nurses and staff look at this assessment, they see it as more than just a checklist, as more than just a flow sheet or a BPA that's flashing in front of you. I hope that when they see that, they see my face. They see the pregnant person that's sitting in front of them with their baby or babies that are coming, that they are saving a life, and they are advocating sometimes for somebody who's too stubborn to advocate for themselves because they're so used to taking care of others.